For decades, stigma's attached itself to different communities, ethnicities, and even health-related issues, from cancer to HIV and AIDS, and now mental health. But people around the world are working to break that stigma, including Dr. Olusola Ajilore. He's an associate professor of psychiatry at the University of Illinois, Chicago. Thank you so very much for joining us, Dr. Ajilore. Now, in addition to the work that you do in the lab or at the hospital, you also go out to different communities in Chicago and try to destigmatize mental health. Why is that?
Yeah, I think one of the reasons why there's been a lot of stigma, and particularly in the Black community, is that there's a concern about being labeled crazy, because that's something that traditionally has been applied to marginalized people, even if the label wasn't accurate, or especially if the label wasn't accurate. So there's a lot of distrust in these communities when it comes to dealing with psychiatry or dealing with mental health providers. I think one of the things that's helping to reduce that stigma is having more people of color serving as clinicians, serving as psychiatrists, psychologists, social workers, nurse practitioners. I think by having more clinicians that look like the patients they serve is helping to reduce that stigma.
Tell me about your work specifically. What does your day-to-day look like when treating patients?
So our lab does research where we use brain imaging, like using an MRI scan to look at the brain to better understand different psychiatric disorders, particularly mood disorders like depression or bipolar disorder or anxiety disorders. And we're also working on using smart connected technologies like smart speakers, like your Alexa speaker, smart watches, or smartphones to better track and treat these disorders. So currently we have three ongoing studies. One is in late life depression, where we're using brain imaging and Fitbit data, as well as data from smartphones to see if we can predict who will relapse after getting well with treatment for depression. One of the problems with older adults with depression is that it's very hard to treat them. They don't respond to medications as well as younger patients, and they're more likely to relapse. So we're trying to use brain imaging and technology to come up with ways of predicting when they're going to have another episode, with the idea that if you can intervene early, you'll have a chance to give that patient a much better outcome.
I know you have a few other studies with colleagues as well, but what's interesting to me is that they all seem to revolve around technology, the phones, the apps on them, artificial intelligence. Why are you using that to really help diagnose and treat people?
One of the challenges that we have in psychiatry is that, unlike other branches of medicine where you have things like a stethoscope, where you can do a chest x-ray, we have no clear objective ways of understanding how our patients are doing in response to the treatments that we provide. We really just ask the patients, how are you doing? And sometimes that's not the most accurate report, especially when somebody is dealing with depression or schizophrenia or bipolar disorder. They may not be accurate reporters of how they're doing. And so we're really interested in seeing if we can use technology to develop more objective ways of assessing how our patients are doing. And so technology is sort of a nice tool, because something like a smartphone, about 80% of Americans have access to a smartphone. And we can use this computer that's in everybody's pocket and use how we interact with this device to infer information about how people are thinking, about how they're feeling. And so we can use that in conjunction to what we traditionally do by just asking the patient how they're doing or observing how they're doing. We can use technology to get more precision and more accuracy in our diagnoses and tracking how our patients are responding to treatment.
Since you've started your work, do you think that the perception of mental health has changed? Are your patients more open to talking about it?
Yeah, I think it's been incredible to witness how celebrities, athletes, musicians have come out and been open about their own mental health struggles, and also giving voice to these problems and providing a language for people to talk about these struggles in their own lives. So I think all of those public health efforts and those outreach efforts are helping to give voice to what people didn't feel comfortable talking about just a couple years ago.
All right, great. Well, Dr. Ajilore, thank you so very much for joining us. It was great talking with you.
No problem at all.